Hi, I'm Dr. Aditi Shah Kaskar, consultant hematologist, hemato-oncologist and bone marrow transplant physician at HCG Hospital, Borivali. And today I'm going to speak about bone marrow transplantation. So there are certain type of blood disorders where the only way to cure them is by bone marrow transplantation. So what is bone marrow transplant and when do we do it? There are certain type of blood disorders, namely malignant blood disorders like acute leukemia, chronic leukemia with blast crisis, myelodysplastic syndrome, myelofibrosis, and non-cancerous blood disorders like aplastic anemia, thalassemia major, sickle cell anemia, severe disease, where the only way to cure is by bone marrow transplantation. In bone marrow transplantation, we give strong high-dose chemotherapy with or without radiation therapy, which kills all these cancerous or diseased cells. However, along with it, your normal bone marrow cells also gets destroyed. In order to recover the hematopoietic, that is the normal blood cells, we infuse stem cells. There are two types of bone marrow transplantation depending on what type of stem cells are infused. Autologous transplantation is where the stem cells are collected from patient itself. Here the risk of life-threatening complication is very low. Allogenic transplantation is a process where another donor is selected who will give stem cell for transplant. The selection of donor depends on the matching of the donor with the patient. Donor can either be a sibling who can be a fully matched donor, or it can be a sibling parent or child. Parent and child are usually a half-matched donor, or it can be a donor from a registry where lakhs of people donate, register and are willing to donate stem cells, and usually we select a fully matched donor from this registry. How is this procedure done? Is it a surgery? So neither stem cell transplantation is a surgery nor stem cell donation is a surgery. I will speak first about donation. So there is no immediate or long-term complication to the donor. It is a type of blood donation procedure wherein we collect stem cells via a peripheral catheter, either a CVP line or a IV cannula. Procedure may take about 4 to 6 hours. And the donor will be discharged on the same day, and donor has no long-term complication. Coming to the patient, again there is no surgery performed on the patient. We give high-dose chemotherapy, radiation therapy followed by the stem cell infusion, and it is post-chemo radiation that about 1 to 2 weeks patient will be having low WBC count, low platelet count, and requires a very strong supportive care. And these stem cells will act like a seed. Like the seed grows into a full plant, these stem cells will grow into a normal blood, that is the hematopoietic system of the patient. This procedure usually takes 3 to 6 weeks depending on what is the type of transplant. 3 to 6 weeks total duration of admission. Where is it done? So we have special bone marrow transplant unit. At HCG we have a unit with 4 beds where there are rooms with special HEPA filter which prevents the entry of air which has fungal infection and certain bacterial infection. It has a triple door entry. So to enter the room you have to go through 3 different doors. Restricted entry, special staff who can manage these patients, and special supportive care unit. Till now, we have performed 50 bone marrow transplant at our center, 25 autologous and 25 allogenic. And a lot of our patients who would have died because of the disease are surviving post-transplant, and it makes us immensely happy to see them. That is why I urge patients who are suffering from these types of blood disorder to not fear from bone marrow transplantation. Although it has its own set of complications, but if you are able to conquer each step, there is a light at the end of the road and a life after transplant without the disease. Thank you.